Welcome back to NASM CPT exam prep. This is chapter 16 of 20, closing out the program design domain. Today's lesson is chronic health conditions and functional limitations. We'll cover training considerations for older adults, obesity, pregnancy, and common chronic conditions, and the scope of practice framework for knowing when to refer out. Let's get into it. By the end of this lesson, you'll be able to do 5 things. First, distinguish what's inside versus outside a personal trainer's scope of practice. Second, explain the purpose of a PAR-Q and when it's used. Third, describe general training considerations for older adults, obesity, and pregnancy. Fourth, apply a general safe training pattern to hypertension, diabetes, and arthritis. And fifth, recognize the red flag scenarios that require referring a client to a physician. 5 objectives. Let's build them one at a time. I want to say this directly before we go any further. Nothing in this lesson is medical advice, and it isn't a substitute for a client's own healthcare provider. Here's what actually matters for the exam and for real practice. It cares less about memorizing exact clinical thresholds and more about whether you know the general safe principles, and critically, where your scope of practice ends. Let's build the framework everything else in this lesson hangs off of. Inside scope, screening intake, like a PAR-Q, general safe exercise principles for a known condition, monitoring how a client responds during sessions, and referring to a physician when something looks off. Outside scope, diagnosing a condition, interpreting lab results or medication changes, or telling a client to adjust their prescribed medication based on how a workout felt. And the PAR-Q itself, a physical activity readiness questionnaire, a short screening tool used before starting a new client to flag anyone who should get medical clearance before beginning an exercise program. Get this inside versus outside split very clear before we move into specific populations. This shows up constantly on the real exam. Let's look at our first special population, older adults. The biggest risk to program around? Falls. Regular, well-designed training is one of the most evidence-backed tools for helping older adults maintain independence, improving balance, coordination, reaction time, glucose tolerance, and bone health along the way. Progression should be slow and closely monitored, grounded in postural control rather than a fixed timeline. Balance and stability work deserves more programming weight here than it would for a younger, healthy client, and progress toward less external support only as control genuinely improves. For example, from a supported seated position toward freestanding. Falls really are the single organizing risk for this population. Everything else in the programming approach follows from minimizing that risk. Now let's look at clients managing obesity. Joint stress is the starting consideration. Extra body weight adds mechanical stress to joints, especially the knees and ankles. This often makes lower impact modalities, cycling, swimming, water-based exercise, a sensible starting point. Monitor cardiovascular response. Cardiovascular health may already be compromised, so intensity should be introduced gradually, with appropriate monitoring, using the intensity monitoring methods you covered back in Lesson 15. And here's a mindset shift worth internalizing. Adherence beats aggression. Understanding a client's motivation and building a plan they'll actually keep doing tends to outperform a harder plan they quit in 3 weeks. Now let's look at pregnancy and postpartum line here. Physician clearance is a hard scope of practice line here. Exercise during pregnancy offers real benefits, but it always requires clearance and ongoing communication with the client's own healthcare provider. Common general modifications: avoiding prolonged supine, flat on back positions after the first trimester, and adjusting intensity as the pregnancy progresses. Postpartum return to training. Core and pelvic floor focused work is commonly emphasized. both during pregnancy and in a gradual, individualized postpartum return. This is really the clearest example in the whole course of a hard scope of practice boundary. No ambiguity. Always defer to the client's physician. Let's look at a general framework for chronic conditions. Hypertension or cardiovascular disease. Favor moderate, monitored intensity. Avoid breath holding, the Valsalva maneuver, during heavy lifts. Dizziness or chest discomfort means an immediate stop. Diabetes or blood sugar management, watch for hypoglycemia symptoms. Consistent exercise timing can help, but medication timing is the physician's call. Arthritis. Favor low-impact modalities and full range of motion on good days. Train around pain, never through sharp pain. Here's the exam-relevant skill. It isn't memorizing exact clinical numbers. It's applying this same general pattern. Monitor, moderate, refer on red flags across every condition. Let me say this clearly one more time. Everything in this lesson is a general educational overview for exam prep purposes, not clinical guidance. Any real client with a diagnosed chronic condition should be working under their physician's guidance, with the trainer's role limited to safe, well-monitored programming, inside scope of practice. Never diagnosis, never medication advice, never overriding a doctor's instructions. Let's check your understanding. Question: which of the following is outside a personal trainer's scope of practice? Take a second and think it through. The correct answer is advising a client to adjust their prescribed medication based on today's workout. Here's why. Advising on medication is a medical decision outside a trainer's scope of practice. Screening, general programming, monitoring, and referral are all appropriately inside scope. One more question. A client with hypertension is lifting heavy weights. Which technique should be avoided? Pause and think back to the chronic conditions table. The correct answer is breath holding, the Valsalva maneuver, during heavy lifts. Here's why. Breath holding during heavy lifts sharply raises blood pressure. That's a specific concern to avoid with hypertensive or cardiovascular clients. Let's bring it all together. Scope of practice covers screening, general programming, and referral. Never diagnosis, medication guidance, or overriding a physician. A PAR-Q, or equivalent screen, is the standard first step before training any new client. Falls are the biggest risk to program around for older adults. Balance and postural control deserve extra programming weight. Obesity programming favors low-impact modalities early and prioritizes sustainable adherence over aggressive intensity. Pregnancy always requires physician clearance and ongoing communication, a hard scope of practice line. And hypertension, diabetes, and arthritis each have a general safe training pattern, but exact clinical thresholds are a physician's call, not a trainer's. This closes out the program design domain, the highest weighted section of the real exam. Great work getting through Lesson 16. Next up is Lesson 17, Nutrition. We'll cover macronutrients, micronutrients, hydration, and where a trainer's nutrition scope of practice ends. See you there.